passed. Residents who evacuated are now allowed to return to their homes after 3 offshore earthquakes triggered tsunami warnings in the country. Philippine Ambassador to New Zealand, Jesus Gary Domingo, is on the line to give us an update on the situation of Filipino residents in the area. Ambassador Gary, good morning. Could you tell us how many Filipinos were evacuated since the tsunami warnings were raised?
Kiara, magandang umaga po, Charles. Okay, well, we only have estimates of the affected Filipinos kasi unang-una po, New Zealand has a very good civil defense. So it's not like, crisis areas where we have to have exact count. But our estimate would be at most just a few dozen or low hundreds, if ever, at most, of affected Filipinos.
All right, Ambassador Gary, how strong were these earthquakes and what were the hardest hit areas?
Okay, well, actually, the earthquakes, there were 3 earthquakes, but they were offshore. So the mainland of New Zealand was not affected. So we just experienced some tremors, but you sort of probably read the 8.1, 8.5. That was way offshore, several hundred kilometers offshore of New Zealand. But the effect would have been the resulting tsunami. Right. Requiring then the evacuation earlier this morning, New Zealand time, but the authorities said, oh, okay, things are okay now, people can start going home. But people are still on alert, just to avoid being near the coastal areas in the northern part of the North Island of New Zealand.
All right, do we have any news of possible aftershocks or maybe its effects?
Well, it's always possible, but you can't really predict that. But it doesn't seem to be it's not very likely. And again, the effects, if ever, would be the tsunamis, as what has happened. But right. The main tsunamis have passed. But since there were a sequence of earthquakes, it's entirely possible there could be some more. But again, these things cannot be predicted, but certainly. But we are on alert.
Right, you guys are definitely still on alert. But then, has the Philippine government reached out to the affected Filipinos in the area, and what are the next steps you're looking at?
Well, on one hand, we have 80,000 Filipinos in New Zealand, and half of them are in the northern part of the North Island. Auckland City has about 40,000 Filipinos, but Auckland City is about 100 kilometers away from the evacuated areas. So, by and large, New Zealand has a very effective civil defense. So the embassy does not have to make its own arrangements with our kababayan here in New Zealand because they're well taken care of by New Zealand civil defense. Nevertheless, we are urging Filipinos to please register with the embassy. We are urging Filipino community organizations to register with us. But otherwise, we are in good touch with the Filipino community through social media, through our own Facebook page, through our website, and we have very good community Facebook pages where we have active outreach.
All right, thank you for your time and stay safe. That was Ambassador Jesus Gary Domingo.
I would like to appeal to all our kababayans, please get vaccinated against COVID-19 and be the government partner in preventing further spread of the disease. I encourage you to get vaccinated as soon as possible time. These vaccines are safe and they are the key to reopening our society. We may not be out of the woods yet, but we are making progress and the end is in sight. And with your cooperation, we will overcome this pandemic and ensure the health and safety of everyone.
Infectious disease experts are defending Astrazeneca vaccines despite the reported decrease in its effectivity against certain variants of the virus. Dr. Edsel Salvana told Radyo 5 that the study that found decreased protection from AstraZeneca shots has not been peer-reviewed. The study is still in the so-called preprint stage, which means any results are still inconclusive. Nevertheless, he says the same study showed consistent protection against severe cases of the virus.
Bagamat sinabi nga nila na mukhang 10% lang yung naging protection against disease, lahat nung nagkaroon ng disease, puro mild. Walang namatay, walang na-hospital. Nagsalita na rin ang WHO tungkol dyan. At ang sabi ng WHO na wala pong conclusive evidence na wag nating gamitin itong Astra sa mga bansa kahit meron na silang South African variant.
Dr. Anna Ong Lim shared this statement, saying recent studies about the effects of Astrazeneca still need to be verified. She also said the South African variant has not spread all over the country, so we should not be too hesitant to use the vaccines that we have so far.
Hindi pa naman ganun karami yung kaso ng South African variant sa ating bansa, and hopefully hindi nadadami kasi talagang magiging malaking problema yan. Now, dahil naman ganun, bakit naman hindi natin pakikinabangan itong bagong darating? May pagpipilian na tayong dalawa, di ba?
Another infectious disease expert believes that the Astrazeneca vaccine can provide protection for healthcare workers beyond 60 years old. In an interview with The Big Story, Dr. Ron Jean Solante said that the Astrazeneca shot is effective against symptomatic COVID-19 infections, even for the elderly. The Sinovac shot, on the other hand, is not recommended for individuals aged 60 and above because its late-stage trial data was gathered only from 18 to 59-year-old participants. Solante added that the South African strain should not hinder the rollout of AstraZeneca vaccines because this is not the dominant variant in the country.
Since we are still in the priority population, which are the healthcare workers, the frontline healthcare workers. So this will still be the vaccine that can still be used for the healthcare workers, for those with comorbid conditions, and for those healthcare workers who maybe are already 60 years old and above.
Meanwhile, other countries have also approved the use of AstraZeneca shots on their elderly. Germany's vaccination authority has approved the use of the vaccine on people over 65, while Sweden likewise extended its recommendation for the AstraZeneca shot to cover the elderly. This day last year, the Philippines recorded its first COVID-19 case from local transmission. It was then rushed to the Cardinal Santos Medical Center in San Juan. Today, the hospital is finally receiving shots against the virus. Let's get the latest on this with JC Cosico. He's reporting live from San Juan. JC, how's it going over there in San Juan?
Charles, the Cardinal Santos Medical Center began the mass vaccination of its employees with China's Sinovac vaccine. Today, 250 persons are expected to receive the jab. CSMC received around 1,300 doses of the China-made vaccine, enough for 650 persons. March 5 also marks the anniversary of the country's first local transmission of the virus, which was also admitted here at the hospital. Initially, around 1,900 individuals from the facility were willing to get vaccinated, but some of them backed out after they were told they will be receiving Sinovac. Officials, however, noted that the number of personnel willing to receive the jab is gradually increasing. They also intensifying their communication campaign to reduce vaccine hesitancy. Meanwhile, CSMC Medical Chief Dr. Zenaida Javier Uy says they're in coordination with the DOH for AstraZeneca jabs. There is no exact date yet on the arrival of the jabs, and so far no medical frontliners have changed their minds after the arrival of the British-Swedish drug. Charles, Dr. Uy said that some senior citizens expressed willingness to receive the jab, but they need to sign a waiver as it is not recommended for them. Now, the hospital targets to finish the immunization by next week. Back to you.
Thanks for that, JC. That was JC Cosico reporting live from San Juan. Inflation accelerated further in February on the back of higher prices of food and non-alcoholic drinks. Prices rose by 4.7% in February, quicker than the 4.2% that was recorded in January. Still, February's inflation print fell within the Bangko Central's target of 4.3 to 5.1% for the month. The PSA also noted price hikes in rice as well as transport costs, as BSP Governor Ben Diokno earlier said that inflation may likely ease by the second half of the year. And those are the top stories of the hour. Join us later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We are One News.